They're not testing. They can't test. They don't have the capability of testing. So what would they report? But just so that it's abundantly clear, for public health purposes and as contained in various laws that we have, these things are reportable to the ministry. And the labs have been advised that they need to report this, and so that if they, by some means that they have that is unknown to us, have been able to detect these various strains, then they ought to report that to the ministry. As it is, as of now, we have not received any such report from Eureka Medical Laboratories. And I've asked last week the Chief Medical Officer to write to Eureka Medical Laboratories for the results that purportedly they have of these new strains that they have discovered in Guyana. To date, we have not received any such reports from them. However, since we're not doing genetic sequencing, it is going to be very difficult to unearth whether or not we have that strain in the Caribbean. It is only if we have a very proactive program of surveillance using genetic sequencing that we'll be able to detect this. That's how the UK was able to detect this type of mutation, because about 10% of the persons who they test, they automatically take those samples and do genetic sequencing on them to look at the mutations that is happening with the virus. We have not, and when I say we in the Caribbean, have not established such a surveillance program using genetic sequencing. And until we do that, it is going to be very difficult to analyze what strains we have circulating in the region. So perhaps as a Caribbean region, we need to build that capacity. In the interim, CARFA has set up a project where they would be able to do a limited amount of genetic sequencing, and countries are invited to send at least 10 samples to them per month so that they can do the sequencing. Out of that, then maybe we'll start building a picture of what strains, what types of viruses are, or what clades of the virus are circulating in the region.